tube-shaped medical device placed to keep narrowed or blocked vessels or ducts open. They are generally made of a metal mesh structure and are most commonly used in cardiovascular diseases. The stent adheres to the inner surface of the vessel, ensuring that blood flow continues regularly. A stent is a small tube-shaped medical device placed to ensure that narrowed or blocked vessels and certain ducts remain open. Generally made of metal mesh, stents are used to regulate blood flow or fluid passage. Although they most frequently come to the agenda in cardiovascular diseases, stent applications are also performed in renal tracts, bile ducts, and various vascular regions. Stent procedures are mostly carried out through interventional methods, without the need for surgical incisions. What is a stent? A stent is a supportive structure placed inside a narrowing or clogging vessel or duct to keep that area open. Its most common area of use is the heart vessels. However, it is used not only for the heart, but also in brain vessels, leg vessels, urinary tracts, and bile ducts. Stents are generally made of metal alloys in a mesh or cage structure, placed by expanding with the help of a balloon. Some types of stents are drug-eluting, medicated. These stents help reduce the risk of re-narrowing within the vessel. Why is a stent placed? One of the primary reasons for placing a stent is coronary artery disease occurring in the heart vessels. In this case, atherosclerotic plaques formed in the vessels block the blood flow, and the heart tissue cannot receive enough oxygen. Consequently, serious conditions such as chest pain, shortness of breath, or a heart attack may occur. The main reasons for placing a stent are narrowing of the heart vessels, coronary artery disease, ensuring vascular patency after a heart attack, kidney stones or urinary tract obstructions, blood flow disorders in leg vessels, bile duct obstructions. Especially if there is a severe narrowing in the heart vessels, blood flow decreases, leading to chest pain, angina, or the risk of a heart attack. In this case, a stent is a life-saving option. Where is a stent placed? Stents are placed in different parts of the body to keep narrowed or blocked vessels or ducts open. Although most commonly used in heart vessels, it is not limited to the heart. The answer to the question, where is a stent placed, varies according to the location of the obstruction and the underlying disease. To the heart vessels, coronary arteries, stents are most frequently placed in the heart vessels. In coronary artery disease, plaques formed inside the vessel reduce blood flow. This narrowing leads to chest pain, angina, or a heart attack. During coronary angiography, a stent is placed in the narrowed area to keep the vessel open and provide sufficient blood flow to the heart muscle. To the brain vessels, if there is a severe narrowing in the brain vessels, the risk of stroke, paralysis, increases. In this case, a stent can be placed in the brain vessel by interventional radiology or neurology teams. The aim is to increase blood flow to the brain and reduce the risk of stroke. To the leg vessels, peripheral vessels. When there is narrowing in the leg vessels, pain while walking, coldness, and circulatory disorders are observed. This condition is called peripheral artery disease. A stent can be placed in the leg vessel to improve blood circulation and reduce pain complaints. To the kidney, ureter, tract. When urine flow is obstructed due to kidney stones or urinary tract narrowing, a kidney stent, ureteral stent, may be placed. This stent ensures the comfortable flow of urine in the canal between the kidney and the bladder. It is generally used temporarily and removed after the problem is resolved. To the bile ducts. If there is a blockage in the bile ducts, jaundice and digestive problems may develop. In this case, a stent is placed in the bile duct using endoscopic methods. The goal is to restore bile flow and reduce pressure. To the respiratory tract, bronchi. In rare cases, if there is a narrowing in the respiratory tract, especially if a tumor or severe structural narrowing is involved. A bronchial stent is applied to keep the airway open. This procedure provides relief in breathing. How is a stent placed? The stent procedure is generally performed using the angiography method. During this procedure, a large surgical incision is not made. The process generally proceeds as follows. A thin catheter is placed into the vessel. The narrowed area is identified through imaging. The narrowed area is expanded with the help of a balloon. The stent is placed on the balloon over the relevant area. The balloon is inflated, opening the stent and fixing it to the vessel wall. The procedure is usually performed under local anesthesia, and the patient is often discharged on the SAMI.